All right, it doesn't matter how old you are, anyone can suffer from a stroke at any time. Stroke is the fourth leading cause of death, and May is American Stroke Month, so we want to make you aware. Joining us today to help us recognize the signs of a stroke is Ciara O'Brien, and she's with Olathe Medical Center. Thank you so much for joining us on this Memorial Day.
Thank you for having me.
So let's talk about the symptoms first off.
Okay, those symptoms can be very minor, and a lot of times those symptoms involve paralysis of one side of the body. It can be as simple as numbness or loss of sensation and weakness to that side of the body. It can be facial droop, difficulty speaking, and some patients will complain of visual disturbances.
And sometimes, too, some patients may not even know that they've experienced a stroke. So I guess, how do you know, and when is it time to call a doctor?
Well, usually symptoms of stroke occur suddenly, and so many times a patient will experience facial droop or difficulty speaking or not quite know where they're at, or loss of coordination and balance, and they should call their doctor or make a call to 911 immediately.
Don't waste any time.
Right.
When it comes to certain age groups, are certain people and certain age groups hit harder than others?
Not necessarily. A stroke can happen at any age. I personally have taken care of people in their 20s and 30s who have had a stroke. So it's not just for the elderly. There are certain populations that are at higher risk, certainly those patients who have high blood pressure.
Are there certain races at a higher risk than others?
Yes. African Americans are known to be at a higher risk, and that may be related to a higher risk for high blood pressure as well.
Talk about hypertension and salt intake. It's very important for us. I mean, and everything that we have and we eat, and even restaurants, I mean, just full of salt and sodium.
Right.
How can we do a better job to make sure we're not consuming so much?
Right. Well, it truly is personal choice, and we hear about it in diet all of the time. Loss of weight, improved exercise, lower salt intake, watching our sugar and our fat intake, and really it is a personal choice and an awareness. And certainly if you have risk factors in your family for high blood pressure, if you're currently taking high blood pressure medication, it's something that you need to be compliant with and aware of.
When you say risk factors in your family, you had mentioned that you've even treated people who are in their 20s who have dealt with a stroke. Is that most likely because of hereditary, like it was in their family, and so it's that important for you to know?
Right, right. We need to remember that stroke is cardiovascular disease. So even if you have risk factors for
life.
Right. If you have risk factors for heart attack, most likely you have some risk factors for stroke as well. It is heart disease.
Okay.
And so those patients in their 20s and 30s, it could be something hereditary. It could be lifestyle that they could modify. If they smoke, they should stop smoking.
Okay.
If they have high blood pressure, they're obese, they have some options to make some better choices.
All righty. Thank you so much. And once again, this is Ciara. She's with Olathe Medical Center, and taking time off on this Memorial Day to talk about stroke and just making everyone aware about the importance of living a healthy lifestyle. We appreciate it.
Thank you.